Assalamu alaikum. On behalf of Ahsan Academy, let me welcome you to a presentation on veins of the abdomen. In this presentation, I will cover the following subjects: the general idea on the veins of the abdomen and formation of those veins in the wall of the abdomen, and general aspects of the portal circulation, as well as the veins origin from the pelvis. At every stage, I will try to correlate clinically. The veins of the abdominopelvic cavity can be described under two headings: the veins of the pelvis and veins of the abdomen proper. The abdomen proper vein may be described under two headings: the portal circulation and the systemic circulation. In this way, I will proceed to describe the veins of the abdominopelvic cavity. So the pelvic veins actually arises as a plexus of the vein in the inner or outside the wall of different organs. So this has interconnecting venous plexus around the viscera, and they are named as the rectal venous plexus. Naturally, you can guess that it is near to the rectum and anal canal. The vesical venous plexus, it is close to the urinary bladder. So both these two plexuses are present in male as well as female. There is sex difference in origin of the prostatic venous plexus in male and uterine as well as vaginal venous plexus in case of female. I am not describing the veins of the perineum. The second set arises from the wall of the pelvic cavity. In female, you can see these are the organs of the pelvis. The vesical plexus is formed close to the anterolateral wall of the urinary bladder and also to the base of the urinary bladder. This is the rectal venous plexus present within and outside the wall of the rectum and anal canal. This is the uterine venous plexus, which is continuous below with the vaginal venous plexus. Actually, flow is from the vaginal to uterine venous plexus. So all these venous plexus form efferent veins. These veins combine and open into the internal iliac vein. So these are the veins of the systemic circulation. Through the internal iliac vein, this reaches the vena cava and finally to the heart. So there is only one set of capillary. But you can see this is the superior rectal artery that continues above as inferior mesenteric vein, and this one is the portal circulation. I'll describe this portal circulation with abdomen cavity proper. In case of male, you have seen that there is no uterus in between rectum and urinary bladder, but another organ is below the urinary bladder, that is the prostate. So this plexus around the wall of the prostate is known as prostatic venous plexus. This is, as usual, the venous plexus around the urinary bladder is the vesical venous plexus, and rectum and anal canal, it is the rectal venous plexus. So here these three types of venous plexus combines to open into the internal iliac vein. So this is systemic circulation. Now again, there is the superior rectal artery who continues above as the inferior mesenteric artery, and this is part of the portal circulation. So now let us proceed towards the abdomen cavity proper. Up to the previous slide, we have discussed the pelvic veins. Now in the abdomen proper, we can divide the circulation into two parts. This is systemic circulation and the portal circulation. Systemic circulation, this is having once the systemic circulation has one set of capillary in the wall, and this is finally reaching the heart. But in case of the portal circulation, there is one set in the alimentary tract and other organs, and then combines to form a large vein that goes inside the liver, divides it into capillaries again. So two sets of capillaries are there, and then it unites to form the large vein opening into the vena cava and finally going to the heart. So two sets of capillaries are there in this circulation. This is portal circulation. Let us start with portal circulation. You can see this is the portal vein. Here it is formed, and this one is the superior mesenteric vein, and this one is the splenic vein. So splenic vein and superior mesenteric vein together forming this portal vein. This one is the inferior mesenteric vein who opens into the splenic vein. So there is variation of arterial route and the venous route. This one is the rectum, and this is sigmoid colon, descending and colon, and this one is the ascending colon, cecum, vermiform. All from all this stomach, spleen, pancreas, from all this structure, the blood is drained into the portal vein, and portal vein goes into the liver and ultimately forming another set of capillaries. And again, this capillary unites together to form the hepatic vein, who opens into the vena cava to reach the blood that reaches the heart. Let us start from below. The inferior mesenteric vein coming from the pelvic cavity, draining the blood. Already we have understood that the form in the veins, small veins are formed in the wall of the rectum anal canal, and also outside the rectum anal canal, forming the rectal venous plexus, all unites together to form the superior rectal vein. So the superior rectal vein has communications with the middle as well as inferior rectal veins, and you can see this vein is combined together and going up. It ascends superiorly as superior rectal vein, and it deviates towards the left side, and you can see this is the superior rectal vein, goes towards the left side. It is not a median structure, though it is single in number. It goes up, in the way it receives the sigmoid venous veins, multiple sigmoid veins, and continue above, and you see it becomes the inferior mesenteric vein. This inferior mesenteric vein finally opening into the splenic vein. This is the splenic vein. It is opening on the left side, so it's actually going following the course on the left side of the wall, abdominal wall. Vertebral column is on its right. We can see this one is the splenic vein. Let us label it. This one is the splenic vein. This one is the spleen. So spleen has hilum. So the number of small veins coming out through this hilum fuse together to form this splenic vein. So a series of veins are there. Actually, spleen has lobulated appearance, and from each lobe, these veins are coming out. This splenic vein on the way receives a vein from below. This is the inferior mesenteric vein. Already we have discussed that superior rectal vein collect blood from the rectum area, and it finally collects other bloods from the sigmoid colon and drains into this inferior, continues as the inferior mesenteric vein, who opens into the splenic vein. So this vein is present on the left side. There is no vein, similar vein on the right side. It is collecting blood from the midline and becoming left. Here, this is the superior mesenteric vein, and this superior mesenteric vein behind the neck of the pancreas, this unites together to form the portal vein. You see, this is the duodenum. Concavity of the duodenum contains the head of the pancreas that extends towards the hilum of the spleen. So this area occupied by the pancreas, and at this level the neck of the pancreas is there. I will discuss. You can see this one is the superior mesenteric vein, already I have discussed. So this is arising below from the ileocholic vein. You see, this is the terminal part of the ileum and beginning of the colon. So this is ceca. So collecting blood from the distal part of the ileum, cecum, vermiform appendix, ascending colon. This all bloods are collected by this one and continue as superior mesenteric vein. This on the way collects blood from the uh, blood from this ileum and jejunum. Actually, this lies in the, it enters into the root of the mesentery, and after entering into this root of the mesentery, it follows the course of the corresponding artery remaining to the right of this artery. So this lies right to the superior mesenteric artery, and all through it receives several veins from ileum and jejunum. Goes anterior to the this one jejunal vein. This is ileal veins, and it passes anterior to the third part of the duodenum. This is the duodenum, first part here, second part descending, then transversely lying the third part towards the fourth part. It is in front of the terminal part of the third part of the duodenum. This crosses remaining within the root of the. You can see this is the pancreas. Splenic artery vein is behind the pancreas, so you cannot see the splenic vein here. This is the superior mesenteric vein. So if we compare with lumbar position, this is the neck, and duodenum is here up to this level, 1, 2, 3. Transpyloric plane here is at the level of the lumbar 1. So you can compare the corresponding position. This is the third part of the duodenum. It crosses from the third towards the second lumbar vertebra, and you can see this is the superior mesenteric artery, and this is superior mesenteric vein. So vein remaining to the right of the artery and crosses the third part of the duodenum anteriorly, remaining close to the distal part of this part of the duodenum. You can see when the pancreas is removed partly from the neck to body, this part is exposed, and you can see the veins which is not visible here. Is the formation of the portal vein is visible here. So this one, you can see that photograph is made a bit larger, and this has made a bit smaller. So you can see the portal vein. You can see this is hidden under the pancreas, and this is the level of the neck of the pancreas. Neck of the pancreas to body is removed, so you can see the portal vein, and it is found behind the neck of the pancreas. So this is a very important landmark where the portal vein is formed. So you can identify the superior mesenteric vein here, and behind the first part of the duodenum you can see the portal vein, and rest of the part hidden by the pancreas. Pancreas is a retroperitoneal organ, so it is fixed with the posterior wall of the abdomen. This is at the level of the intervertebral disc. This is the lumbar 1 and lumbar 2 intervertebral disc, and this is the position of the formation. This is formed by the convergence of these two arteries. So how portal vein is formed? The complete answer is it is the convergence or union of splenic vein and superior mesenteric vein behind the neck of the pancreas at the level of the intervertebral disc between lumbar 1 and lumbar 2. This is the proper answer formation of the portal vein. This one is the splenic vein, and this is superior mesenteric vein. Now portal vein formed here, it ascends and moves towards the right, curves towards the right side to the liver. So portal vein is a very short course, about 8 centimeter course, and we can see this is the portal vein. It ascends behind the duodenum. Which part? This is the first part of the duodenum. So duodenal, this is the first part. It is covering this one, so you can see the section. This one is the portal vein behind the first part of the duodenum. So after formation, it lies behind the first part of the duodenum, and it is in the free margin. It is the right free margin of the lesser omentum. If you can remember the photograph, this is the lesser omentum, and this is the free margin. Behind that, the epiploic foramen is situated. This arrow is in the epiploic foramen. So this portal vein is in this free margin of lesser omentum, ascends behind the first part of the duodenum along with two structures. You can see this is epiploic foramen is behind, and after that inferior vena cava lies behind this. This portal vein passes here. You can see this is the inferior vena cava. This one is the inferior vena cava, and anterior to that is the epiploic foramen. Anterior to that, the free margin of the lesser omentum containing this portal vein. Portal vein runs along with the hepatic artery. You can see the artery. Here is the artery, and this one is the bile duct. So this free margin contains three structures: portal vein, hepatic artery, and bile duct. All these three are covered by lesser omentum free margin, and all this structure remains behind the duodenum in front of the epiploic foramen. Much behind of that is the inferior vena cava. You can see this is the structure. It extending up to the porta hepatis. This is the porta hepatis. It enters into the liver through the porta hepatis. So it ends by entering into the liver. This is the gastric vein. You can see this is the left gastric vein going to the lesser, coming from the lesser curvature and directly opening into the portal vein. Another vein we can see is the posterior superior. This is the pancreaticoduodenal veins are there. Posterior superior one opens directly into the portal vein. Others usually open into the superior mesenteric vein. It's very variable. Some of them may directly enter into the portal vein, or some of the portal vein, tributaries of the portal vein may open into the superior mesenteric vein. So with this area, the venous drainage tributaries are very variable, but these two are mostly opening into the portal vein. So I have mentioned this name of these two. Now this portal vein gets inside the liver, repeatedly ramified, and it is remaining at the corner portal space as a minute branch. This is known as interlobular branch of the portal vein. This is actually a small arteriole. From here the capillary starts, and capillary enters into the lobule, so that runs through the lobule, gets the capillary, fuses with the capillary of the arterial system, hepatic arterial system, and finally the total blood enters into the central vein. So another venous channel starts. So this is the second set of capillary that is formed within the liver. So this is the capillary, and this one is the central vein. This central vein fuses together and makes some areas as a vascular segment. So liver has 8 vascular segments that I have shown, and I will describe in the next slide. that these capillaries unite together and separate vascular segments are formed. These segments are drained by vein, and there is some overlapping, and this fusion of multiple segments leads to formation of about 3 hepatic veins and finally opens into the vena cava. These are the hepatic veins, usually 3 in number, finally opening into the inferior vena. So parietal vein drains blood from the abdominal part of the gastrointestinal tract, that is the distal part of the esophagus, stomach, and continues up to the rectum, anal canal. Also draining blood from the spleen, pancreas, and gallbladder. So all this blood drained into the portal vein. This is the portal vein, and portal vein carries blood to the liver. Here this forms the capillary, and as per the distribution, the liver is divided into 8 vascular segments, you can see. So the first segment that is separated is the caudate lobe. Caudate lobe is a separate segment, though it is smaller in size, but even this caudate lobe may drain the vein directly into the vena cava or can join the other part. And usually it is a separate unit. So caudate lobe is the number first vascular lobe. Then the lower pattern is distributed along the clockwise pattern. So this is the 2, 3, 4, 5, 6, 7, and 8. So these are the vascular segments of the liver. From there, you see the veins are draining. There may be some multiple exit, but usually single exit and fused together with the adjacent lobe and forming larger hepatic vein. Usually 3 hepatic veins are visible. This number varies, may more, may less. This is the right hepatic vein, this one is the middle hepatic vein, and this is the left hepatic vein. So we got that idea about the portal circulation. This is the inferior vena cava finally receiving all the blood. Now let us go for the systemic venous drainage. Inferior vena cava is the largest vein of the abdominal cavity, and it is remaining on the posterior wall of the abdomen. This is formed in front of the lumbar 4 vertebral body by the union of right and left common iliac artery. This is left common iliac, right is hidden under the artery. So this is formed a bit below than the bifurcation of the abdominal aorta. It bifurcates, abdominal aorta bifurcates at the level of lumbar 4, but vein is formed a bit below at the level of in front of the lumbar 5. You can see this is formed here above the sacrum and goes up. This ascends by the side of the vertebral, anterior to the vertebral column to the right of the aorta, a bit right of the vertebral column. This is situated and ascends up. Let's say this is the vena cava, abdomen, inferior vena cava present in the abdomen. It lies behind the duodenum, behind the epiploic foramen. This is the duodenum, epiploic foramen is here, and then it gets inside the liver. This is by the right of the abdominal aorta and in front of the vertebral column, a bit to the right of the midline. Inside this area, this remains in a deep groove inside the lower liver. This is known as vena caval groove. Sometimes the liver tissue become a continuous bar, and vena cava may be within the liver. So this important relation is having some clinical significance. Let us go for the tributaries of the vena cava. You see this is the area of formation. So it is formed by the right and left common iliac vein in front of the lumbar 5. So this is the tributary that forms the vena cava, Now it goes up and receives series of lumbar veins. And this is not same as the artery because the side variation is there, and all the four are not opening in pairs are not opening into the vena cava. And right left is having some variation. This is the gonadal vein, and the right one opens into the vena cava, but the left one goes to the renal vein. Renal vein both opens into the vena cava. The suprarenal, the right suprarenal one opens into the vena cava directly. The left one into the renal vein. The inferior phrenic veins both opens into the vena cava. And we can already have discussed that there are three hepatic veins directly opening into the vena cava. So abdominal part of this vena cava passes through the diaphragm. This is the diaphragm. You can see there is vena caval opening. It's also known as caval opening of the diaphragm. So it passes through this and become thoracic part. But the thoracic part is very small. This is at the level of eighth thoracic vertebra. See, the aortic one is at the 12th level. So after passing through this vena cava opening, this is having a very short course in the thorax and open into the heart. This is the right atrium of the heart. So we are observing the heart from the back. It is the posterior mediastinum. This is the base of the heart. So this you can see a small part of the vena cava that remains within the thorax. Portal systemic anastomosis is clinically very important. You see, this portal vein makes some anastomotic at some areas with the systemic circulation. So esophagus has proximal part, most distal part is having portal circulation, but above this is having systemic circulation. In the lower part of the distal part of the esophagus, there is anastomosis between the portal and systemic circulation. The distal part of the esophagus, the esophageal vein that drains into the azygos vein, anastomosis with the left gastric vein. This is a part of the portal circulation. And around the umbilicus, there is another area of anastomosis. This is between the para-umbilical vein that goes to the portal circulation and some epigastric vein that drains into the vein of the leg. So that's having systemic root. So this is an area anastomosis between systemic and portal. The third important area is around in the wall of the distal part of the rectum and upper part of the anal canal. This is between the systemic one is the inferior and middle rectal artery veins that goes to the veins of the perineum, and the superior rectal vein that continues as the inferior mesenteric vein and opening into the portal circulation, joining the portal circulation. So these three are the most important areas where the portal systemic anastomosis is there. In addition, we will get the other side like bare area of the liver, the portal vein of the liver anastomosis with the veins of the posterior wall. Similarly, the retroperitoneal organs, where it is in contact with the posterior abdominal wall, have some anastomosis with the systemic circulation. Like this is the descending colon, ascending colon, some duodenum, and other parts like organs like spleen is also having, pancreas, duodenum, all having contact with the posterior wall, and the veins makes anastomosis with the veins of the abdomen. But those are clinically less important because the disease affects these first three most. Let us discuss the clinical significance. You see, the liver disease or any other cause that obstructs the flow of the blood, or the blood flow through the portal system is reduced. So liver disease causes narrowing of the veins, so there will be back pressure of the port in the portal circulation. So the blood will try to go to the heart through this anastomotic size, and lateral circulation will be established. Now you see the veins of those area are very narrow, so there will be dilatation of the vein, as well as the veins will be tortuous. So this is known as varicose vein. So esophagus, wall of the anal canal, umbilicus will have some varicose veins who are dilated and tortuous. So around the esophagus, already we have discussed the anastomosis area here. So the blood will flow back, producing some dilatation and tortuosity of the vein. This is called esophageal varices. Around the umbilicus, you can see the veins are dilated, running towards the periphery. Blood is flowing towards the periphery. So this is known as caput medusa clinically. So periumbilical varicose vein, clinical name is caput medusa. Around the umbilica, this is the junction of the upper part and lower part. In this area, the veins you can see they are dilated under the mucosa and tortuous. These are varicose vein of the anal canal, and this is known as a hemorrhoid. Commonly, this is a very common disease. Due to portal hypertension, means increased pressure in the portal circulation, this can happen. Thank you very much for remaining with this presentation.